Good morning and welcome to Local 17 News at 11 a.m. The first topic we are going to discuss today is everyone's favorite topic, politics. What specific topic in politics, you might ask? Well, I think it's kind of interesting anyway. We will be discussing hidden motives of the American government. Believe it or not, there was a time before health insurance was a common practice. Back then, physicians charged patients based on their ability to pay for their services. But as medical care became more specific to the patient and more successful, its demand increased greatly within our populations. This in turn drove up the cost of medical care, and it became so expensive that even middle-class families could not afford the care they needed. Even though physicians did not want any intermediaries involved in the healthcare system, for the fear that these intermediaries would profit from medicine, it became increasingly clear that some sort of intermediary was needed. As stated, being the intermediary in medical costs developed as a coveted and strategic role in which social, political, and economic gains could be achieved. This is where the sneaky American government comes into play. It is reasonable to assume that whoever pays the cost for a person's or family's medical care would stand to gain gratitude and goodwill from the sick and his or her family. For example, political leaders such as Bismarck from Germany have used paying health insurance as a way to strengthen their state or advance their party's interests. The possibility of this goodwill and what it could give them in the future created a powerful motive for the American government, as well as other institutions, to intervene in the economics of medicine. In short, they wanted to turn their good deeds into power for themselves and their party in the future. If you want to learn more about this topic and how it turns out for the American government, read the first chapter in the second book of the novel, The Social Transformation of American Medicine by Starr. To get in on the conversation about this topic, tweet us your response to this thought-provoking question. How different do you think American medical care might be today if we were all insured through a governmental program like other countries, instead of primarily being insured through private health insurance companies? Would this be an overall good or bad thing? Now let's go to Marissa, who is live at the dog park Wiggly Field.